KANO State is a state in northwest Nigeria. The state capital is the ancient city of Kano, its namesake. The state has 44 local governments, with its population currently estimated at 13 million inhabitants. Kano is a successful city with buzzing markets. This reflects in the state's nickname, the center of commerce. However, in spite of its industrialization and convergent trade and commerce, majority of its citizens live in abject poverty. The National Bureau of Statistics report on poverty and equity in Nigeria shows that 55.1% of the population are poor and vulnerable. Similarly, the dependent population is said to be 48%, consisting of people less than 15 years of age and those over 64 years. Majority of households in Kano State do not have coping mechanism for shocks such as increase in price of food items, sickness, disability, and death, as well as departure of working household member.
There are many poor people in the state. There are many vulnerable in the state.
These poor and vulnerable people are those that cannot afford to have their daily livelihood in one way or the other, health-wise, educational-wise, even the food they eat, nutritionally, so they need to be taken care of.
We still have high level of maternal and child mortality. We still have high level of malnutrition. We still have issues around poor immunization coverage. We still have a lot of challenges in terms of how we're doing. Kano has one of the highest out-of-school population, children out of school.
Many statistics have shown that Kano in particular, the level of poverty in the state is staggering.
This unsavory scenario continues to impact negatively on the development of the state, a situation that has prompted the state to take actions and institute social protection programs to reverse the ugly trend of individual and household poverty and bring about improvements in the lives of the state's poorest and most deprived households.
If you look at the 2019 National Bureau of Statistics Poverty Report, Kano has around 55% of the population living in poverty. And if you understand social protection and what it's supposed to do, then I think there's no other time that the state should look at how it develops that sector more than now.
So the intervention of social protection will really help those poor people and the vulnerable people. Whether if you are talking about the aged people, if you are talking about the reproductive people, they all need social protection with a special intervention to take care of them.
All over the world, social protection has risen to become a key policy measure on the agenda of the government to bring succor to the poor and vulnerable citizens.
Social protection is a relatively new concept. But if we look back, social protection has existed in Nigeria as far back as Nigeria has existed. MAMSA was social protection. Better Life for Rural Women was social protection. The Green Revolution was social protection. All of these are social protection, but they were all targeted at people across various phases of the life cycle. Absolutely anybody may get to a situation whereby they need the state to play its responsibility to the citizens, what will sociologists or other people will call the social contract that the state has with its citizens.
Social protection is therefore defined as a mix of policies and programs designed for individuals and households throughout the life cycle to prevent and reduce poverty and socioeconomic shocks by promoting and enhancing livelihoods and a life of dignity.
Social protection has been proven to work in several parts of the world where it has been implemented in South Africa, in Brazil, for example, to help lift people out of poverty. And so it was felt that, it's time for people to begin to get some kind of support, some kind of safety net that allows them to live a life of dignity.
In Nigeria, the government has introduced several social protection programs to address poverty and help reduce the high rate of unemployment in the country. These include the National Homegrown School Feeding Program, the National Cash Transfer Program, Trader Money, and the Graduate Empowerment Scheme and Job Creation Project, NPAR, as well as the Government Enterprise and Empowerment Program.
The National Social Safety Net Coordinating Office is a key partner. The National Cash Transfer Program is a key partner as well, implementing social protection programs. CDGP is basically using the expertise that we acquired over the 7 or so years we implemented the cash transfers in Jigawa and Zamfara to help strengthen the National Cash Transfer Program.
To replicate the efforts of government at the federal level to reduce poverty among the populace, government at state levels are embracing social protection programs to alleviate the hardship faced by the poor and vulnerable.
KANO already has a lot of things they're doing to see and alleviate people that are living in poverty or are vulnerable in the state. But the coming of the social protection policy will help the state to see that we have a coordinated approach in addressing poverty and vulnerability in the state. And the state, there's no double dipping, and there's more coordinated approach in managing that system.
To this end, KANO State, as one of the CDGP2 focal states, alongside Kaduna, Jigawa and Zamfara, is piloting social protection programs and policies in the state to ensure citizens of the state have access to basic needs of life as a right.
In a lot of countries, it's enshrined in their constitutions. The right to water, the right to a decent standard of living, the right to food, good quality education. People have a right to a decent life. People can eat, they can attain their full potential. They don't have to bankrupt themselves if they fall ill.
So social protection is more to do with giving those people a hope, something to believe in, something to fall back to, something to lift them up from the poverty level they are in. Without doing that, you are not only endangering those particular group of people, but the whole society.
You need to support our people. I come from a rural area. My background is rural, and I'm always with my people, and they deserve this support. Because I can tell you now, for the whole of a year, you can hardly see somebody have an income of 5,000. Throughout there, he can never get the 5,000 and blocked. It has to be either from 200, 500 throughout the year.
Social protection is a multi-sectoral sector. It involves everybody. It's not just one sector. And so we are very excited that the government chose Ministry of Budget and Planning to drive this process. And so far, the committee has been set. Work has gone into the process of developing the policy to see that everything that the state is already doing is captured within a framework and in a coordinated approach.
The CDGP2 is working to strengthen the demand and supply sides of social protection services. This way, citizens are able to understand and seek social protection services from the government. Similarly, the government is able to understand the demands from the citizens and provide such services to reduce poverty in the state, especially among the poor and vulnerable.
Social protection is new in Nigeria, and that's what is trending now, because government need to provide that support so that people will not fall into poverty, or could provide a support whereby people can lift people from where they are to another level, like a transformative stage.
Since 2013, with funding from the UK's Department for International Development, DFID, Save the Children, along with Action Against Hunger, have been at the forefront of supporting Nigerian federal and state governments to develop evidence on nutrition-sensitive social protection and to establish effective social protection schemes and systems. Initially implemented as pilot maternal and child cash transfer program 2013 to 2019,
Nigeria has some of the poorest health and nutrition indices. Jigawa State had very bad stunting rates, and same with Zamfara. So the CDGPD program then was part of the then DFID's approach to supporting the Nigerian government to improve uptake of optimal nutritional behaviors and practices in the state.
That was the initial phase 1 of the project. And mothers were provided with a stipend of about 3,000 naira, and later it was increased to around 4,000 naira every month, while they had the liberty to spend the money as they wanted. We also provided them with education to let them understand the importance of proper nutrition to themselves and their children.
That project targets first 1,000 days as pregnant women, plus a cash transfer of 4,000 naira on a monthly basis. So it's a nutrition-sensitive social protection program looking at the poverty level in Jigawa, and the project started in 3 local governments. And this local government was selected based on the poverty level in those local governments.
We realized that after 6 years of implementing that program, a number of women had started livelihood activities which they didn't have before. And that wasn't part of the initial design of the program. It was something that as time went by and they started saving, they realized that they could use that money to enhance their own livelihood by engaging in productive activities like rearing animals, buying grinding machines, and so on.
And so with the support of FCDO, we moved on to KANO and Kaduna, and we started to engage more collaboratively with the National Social Investment Office that has now transited into the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development.
With support of the Foreign Commonwealth Development Office, FCDO, through CDGP Phase 2, Government of Kano State is working to lift a sizable number of poor residents out of poverty by 2030, in line with Sustainable Development Goals (SDGs). The state has taken deliberate steps to provide support for the poor and vulnerable households, to strengthen their resilience to economic shocks and ensure everyone is able to access income that provides security throughout a lifetime.
So we've seen the institutions improve, so the policies being set up, the legislation being drafted, and programs being introduced. So this just shows us that social protection has gone up the ladder of government prioritization of programs.
Now the government will start to intervene, giving them some things out or what have you, trying to make the vulnerable, bring in the vulnerables out of the shock that they have been in.
The state is working with the CDGP to help increase public awareness on social protection with great emphasis on inclusiveness, which gives special attention to children, women, elderly, and persons with disability.
Gwamna a yanzu ya yi approving cewar all disabled da su da 'ya'yansu su zama free, education free, tun daga primary har zuwa university. To a yanzu duk yaron da izo je misali isai form ya samu admission, to zai zo nan office dina, nan ba shi clearance, zai kai makaranta, su ko makaranta za su yi masa register. Muna da student wanda suke tertiary institute a mutum 276 a yanzu, wannan disabled ne da su da 'ya'yansu.
There's a lot of thinking around people with disability, things around looking at gender inclusion, and even children at risk. So there's been a lot of thinking around issue of inclusion in the present policy, which is why it will help to broaden what government is doing so that it reaches those that actually require those services.
All the clusters we have about 9 to 10 clusters of people living with disability, of which the intervention of basic healthcare provision funds enroll them. And apart from that, in Kano, we have what we call KET Fund, Kano Health Trust Fund. Also, there is a coverage in that agency whereby it has a percentage that will cover vulnerable and people living with disability.
In every household that we went, we take the register of all the members of the household. So if there is a person living with a disability there, he will be given a priority, that his name and what have you, the kind of problem he has, and all what have you.
The CDGP program in KANO State is also providing technical support to institutions and systems to enable timely and appropriate response to citizens' needs when in shocks. This includes technical capacity building among civil servants, civil societies, and state actors to ensure increased knowledge and the provision of focused technical support on areas such as reporting and monitoring mechanisms, and ways to create fiscal space for increased investment in social protection.
We really benefit from that because there are a lot of capacity building. Right now, I'm part of the National Social Protection Platform, which we have a lot of meetings, a lot of discussions, sharing experience, and keep ourselves up to date. What is happening in other states? What are the interventions in the other states? What are the wisdom apply, you see, to succeed in their state in terms of the intervention of CGDP program?
Even me myself, I attended social protection course through them in Thailand. You understand, so that they develop my capacity to understand what the social protection is all about, how it differs with the social services, and or social welfare program in government. You understand, and we even also develop the guideline, implementation guideline for the policy. You understand, so this is how the importance of their coming to the state.
CDGP, the actual catalyst for what we achieved this time around. Look at the social protection plan we got. Look at the multi-sectoral action plan on food and nutrition that we got. All the input of the CGDP, that we are able to come to this.
The CDGP are very pivotal to social protection in the state because they were able to guide us in such a way that our social protection programs are being in a coordinated manner. Before the coming of CDGP, the MDAs are going on their own ways. But now, it is in a coordinated manner.
CDGP was there to make sure that the capacities of the government officials are strengthened. So there were different trainings that were made, and a study tour, of course. They traveled to South Africa through the support of CDGP, and they came back. I mean, even the CSOs have been trained on advocacy because they're the ones to make sure that they push for accountability in terms of social protection and actually track.
We are so transparent to them. We don't just hide anything from the state government. So for me, the ownership, the political will, the commitment from the state government, that's why we're able to achieve some of our successes in these two states.
The government of KANO State, with support from CDGP, introduced social protection policy, which reflects the state government's commitment to inclusive governance that leaves no one behind, regardless of culture, ethnic, religious or partisan affiliations, but provides equal opportunity for residents to live productive and dignifying lives.
Luckily, we now have a social protection policy in place. We also have an implementation framework, a kind of a budgeted, costed framework that will help back the policy. There's a lot to be done to ensure that that policy is implemented and taken forward, which is something that we're working with the state.
Those agencies, implemented agencies, we have been involved in the policy. So their commissioners we have been briefed, the legislators we have been briefed on such things, and the advocacy we have been taken go around, and so on and so forth. So I think the government commitment here is okay with us.
Poverty and hunger is multi-sectoral. So the approach towards addressing or minimizing the level of poverty and hunger in the society is not residing in one sector alone. But I believe the State Ministry of Agriculture is the critical or focal ministry to address this issue of poverty reduction and hunger.
KANO has developed social protection policy as well as multi-sectoral action plan on food and nutrition, so as to bring about to reduce the level of poverty, especially in child poverty, good access to education, as many things, and health also health.
The government of Kano State has demonstrated commitment to improving access and quality of education through a number of programs and policies, such as free education in public primary and secondary schools, the school feeding program, free uniforms for pupils, and the free education for persons with disability and their children.
Free and compulsory basic and post-basic education in the state. So in the absence of the fees being collected from parents, KANO is spending more than 200 million naira in upkeep of the schools.
The state has implemented a policy of free and compulsory education. Now our enrollment is more than 100%. So you can see it's directly aimed at those out-of-school children who does not go to school, but now because of a single meal, they go to school.
That is to say, if there is education, then definitely the poverty will give way. But in a situation whereby the poverty, dominates the situation, that may hamper the development of education. Like here in northern Nigeria, we are all clamoring for the development of girl child education. But what hampers that development? Poverty. The parents are willing. They want their girl child to get education. But the cankerworm that is preventing the girls from getting the required education is the poverty issue.
But with the coming of social protection, this issue of girl child or education in the education sector was highly improved. Buses were provided upon which our girl childs were taken to and from schools on daily basis. Equally, the issue of school fees were all withdrawn.
These policies has received a lot of commendation from all and sundry, and the government is trying a lot to make sure that it has at least raised the level of education, particularly at the primary and secondary school level.
If you take the Almajiri situation in northern Nigeria, it's a big issue that it's being dealt with. What can we do to ensure that the Almajiri children are also included in the system that government is being provided, whether it's healthcare, whether it's education, whether it's food?
Specifically, KANO has some fundings that are being utilized to make sure that these vulnerable groups are covered in terms of healthcare provision. And that fund is being used to cover 2 sets of vulnerable populations, and this includes the under 5 and the pregnant women.
KANO State will have a comprehensive social register. So every person that is entitled to that healthcare system is going to be mined out of that register, and he is exclusively for poor and vulnerable persons.
In each community, if you can select those that are the most poor and vulnerable, and you give them 10,000 monthly or 5,000 per se, you will see that if you selected 100 people, you are given 500,000. And to say if that 500,000 is going to be spent within that community, I'm sure the economy of the community will raise up.
But with this 5,000, it makes them, it alleviates the suffering. They can even now contribute to the society.
I could remember the woman saying, even if it's 200 naira, at least it can do something for me in my community. So this is a message we are trying to see, that the government try to come up with interventions that will support their people in their state to have a life of dignity.
There is a lot of evidence that shows that whenever there is cash, women are able to go beyond just access to the cash, but they are able to voice out, to participate, which is women empowerment. And that is the transformative social protection that we want.
The social protection policy of the state is inclusive, robust, realistic, and is intended to spur a well-coordinated social protection system with the intention that no citizen falls below the minimum level of social and economic well-being. The government believes that a progressive society must provide tools and the environment for its citizens to exercise their rights to attain full potentials.
I will still commend Kano State government for what they've done, at least taking a step to even bring MDAs together, to put the structure in place, to start thinking what can we do and how are we going to do it is commendable.
People don't know it's their right for governments to provide for them, and civil society organizations are in the best position to raise awareness amongst the vast majority of people as to the need for social protection.
We have a CSO platform in the state because the CSOs, they are the ones that speak for the people, they speak for the citizen. They are the only people that can address government's issue, trying to see there's accountability and creating that awareness, looking at political will and all.
The overarching goal is to scale up the state social protection activities to ensure that the poor and most vulnerable residents of the state are supported to live productive, fulfilling, and dignifying lives. Therefore, social protection intervention programs and activities in Kano State will henceforth be designed to progressively remove or prevent residents' exposure to shocks that could force them into extreme poverty.
Social protection, as emphasized, should not only just be for poor and vulnerable people, it should cover every stage of the life cycle. At this stage, for today, I might not need social protection because I have a decent job, I have a good education, and all that I want. But then I don't know what the future holds for me, and I might encounter the vicissitude of life in the near future and puts me in a situation whereby I'm unable to afford things I take for granted today. Should that such a situation arise, that's where the state steps in.
With an implementation plan in place, it is expected it to guide social protection policy delivery and support the realization of the laudable social protection objectives of the state in a timely, cost-effective, and realistic manner.
Social protection can't solve all the problems we have, definitely, in the country or in the state, but it will go a long way. For me, I believe if we do it right, we'll see a drop in poverty in this state or in this country.